Thank you much. Excellent, excellent. So I think I want to, first of all, thank the organizers for inviting me. It's such a pleasure to be with you today. And I have around 16 minutes and plus. And what I would like to do, maybe leave you with a holistic system thinking of mental health, building on what Kadri has shared with you, by the way, very important messages about the power of sleep, about the power of your mental status as an individual. So let me start with my journey quickly. I was born in Sudan originally. That's where I am from. I have lived in the UAE, where I flew in actually into Estonia from Dubai via Istanbul. So I had an eventful 16-hour flight, 2 flights and 1 bus ride. So I'm glad to be here. And I have been my journey started in engineering, in quantum physics. But what I found that healthcare is so much complex than just quantum physics, believe it or not. Specifically mental health. Mental health is one of the most important and focal points that are coming up even in the post-pandemic now as we live on, and obviously with the war happening around us, and hopefully that can come to an end at some point. But again, mental health has been the focus of our global efforts and initiatives. So some of the organizations that I worked with, and I'm still working with, because mental health has become a huge phenomena that needs to be focused on, specifically in the young and adolescent population. So I thought I'll start up with some slides that gives you a bit of information on some of the initiatives that are happening across the globe, as well as in the region that I live in, because the advent of Web3 and metaverse and cryptocurrency can help us design some strategies and approaches in mental health, specifically the digital solutions that we can implement in mental health. Again, behavioral change is such an important aspect of bringing in digital solution to enable the tackling of certain issues. So I'm giving you some statistics. I've just read a report from Deloitte that was just published in April about the UK workforce and the mental health, the poor mental health cost in the UK. In 2021, it has been projected and estimated that the poor mental health has costed the UK government over 56 billion UK pounds, right? That's a humongous amount. Another piece of statistics that has been mentioned in this report is attributed to the Great Resignation. Over 29% of the workforce in the UK either resigned in 2021 or planning to resign in 2022. So the advent of the Great Resignation, which is a byproduct of the COVID era, has shown the mental health issues that we have to look at and try to solve. So coming back to the slide, so if you look at it, we are using a lot of great tools, genomics, we are looking at AI and data. So if you are a startup who wants to do work in mental health, put your hand up first. I want to see how many of you actually are doing digital solutions in mental health. Very good. And I know some of you, because you're working on burnout, one of the biggest issues in mental health. Before COVID, burnout was #1 biggest issue after opioid consumption, substance abuse. That was one of the great slides that was shown by the previous speaker about substance abuse. So imagine, burnout is #1 issue in the US after substance abuse. And that was a huge dilemma back in 2019, 2018, and so on. Now, burnout is a reality. It's basically a pandemic within a pandemic. Right. So again, what I wanted to show you here as well, if I can use the laser, but on the right-hand side, you'll see space medicine. By the way, the advent of space medicine and the requirement of mental health in space medicine is becoming a reality. Why is it important for me to mention that? In 2018 or 2020, the UAE in Dubai launched their biggest Mars. It's called the Hope mission. They went to Mars. SARS, but that opened up a whole new area of specialties. How do we use mental health therapeutics in the area of space medicine? Because again, the well-being of your astronauts becomes an important aspect that you need to research. So I'm just mentioning some of those because healthcare is progressing and mental health is always going to be at the heart of it. I attended a conference called Arab Health in 2022. Right? I don't know if you've heard of it. It's the biggest health technology gathering outside the US with over 60,000 attendees, and the amount of signing of deals in this conference exceeds around $1 billion in a matter of 5 days. So what I want to share with you is it's the biggest prediction of 2022 out of that conference. If you ever come to Dubai, just out of curiosity, how many of you have been to Dubai? Okay, there's some good numbers. Arab Health in 2023 will build on this, by the way. 2022, we said the first #1 biggest headache we have in healthcare is behavioral health. The cost of productivity is over $1 trillion across the globe. So again, this is just a huge finding coming out of COVID-19, where we saw great resignation, we saw behavioral change, we saw a lot of mental health issues in the adolescent and the youth community. So what I wanted to share with you, these findings, because immediately after that, there was a strategy that was launched on a federal level in the United Arab Emirates to talk about well-being. And that is an important indication of how globally we are moving into more well-being, into more workforce enablement by looking at the health and the mental status of our workforce. So again, there are other aspects like femtech and female health tech that came in, and a big part of that also looks at the mental health in the female population. The advent of Web3 and technologies like the crypto and the NFTs could help in behavioral change. Again, some of the technologies that could be enablers in behavioral change and in well-being is actually the use of cryptocurrency. So when I looked at the mental health ecosystem, I thought, okay, as you are startups and you want to look at your business case, you want to see what are the areas that you need to focus on. I thought, okay, let's divide the mental health ecosystem into 4 pillars. So we look at governance and regulation, and there's a lot of issues with the legislation around mental health. There is also another pillar, it's the promotion and the early intervention area. There is lack of spending and lack of budgets from a government perspective. However, from an innovation perspective, there's a lot of gaps to cover in this area. And this is divided for you into 3 areas. So looking at promotion and awareness, and which helps you specifically when you go into the community setting. Mental illness and prevention, and that's very important as we are looking at the cost of mental health diagnosis and how it actually impacts our productivity. We need to look at prevention and promotion at an early stage, and then early interventions. When it comes to the service delivery and the hospitals and the community centers that deal with mental health, we have a lot of issues. Lack of psychologists and psychiatrists. We don't have enough workforce to cater for our mental health globally. So how do we deal with that? How do we innovate in the mental health service delivery? And again, these were items, by the way, we designed in 2016-17 when we were working on a mental health strategy for the federal government of the UAE. And we were looking at what are the issues that we can bring in more support, we can bring in more innovation, more partnerships with the private sector, and more startups to come in and help us with. Mental health facilities and infrastructure. And then finally, recovery and community integration. One of the most important aspects, the empowerment programs, because now you're not talking about a patient. Mental health is a family issue, because if you have an individual in your family, the whole family is affected if that individual is mentally challenged. So again, this is very important when it comes to the mental health issue. And again, if you look at the essential workforce that we have healthcare workforce, we have teachers, we have government workers, those are the most affected workforce segments in the US. And if you look at the statistics in the US, the three major aspects in diagnosis that they suffer from: number one, depression and anxiety. And number two, it comes to the suicidal tendencies and suicidal tendencies. And this has been a huge pandemic within the pandemic or after the pandemic. So how can we deal with this as we get into mental health? So what I wanted to share with you as well, and substance abuse. That's the third one that I've just missed out. Substance abuse is a huge, again, item within the mental health gaps that we need to address. So if I give you a bit of, again, definition, according to the WHO or according to the CDC, the Department of Health and Human Services, what I wanted to share with you is the fact that the definitions would actually lead us to understanding, going to basics, understanding the requirements of how we can tackle mental health, especially in the post-COVID era. Because one of the biggest issues that came in with COVID is the infodemic. So the truthfulness and the information layout. And this would actually impact the way we spread awareness and promotion within mental health. How do you secure and ensure the information flow? And that means the right information to the right people at the right time. Again, another element of mental health that would allow us to focus on spreading awareness, because prevention in mental health would allow us to save up in terms of the cost. So if you look at the scientific literature that we out there and look at the major risk factors that you will see in the mental health status, it splits into three areas. So biological, social, and psychological. And this is very important as you build your business case to bring in digital enablers. It's very important to look at the biggest gap with the fastest and quickest solution, especially when it comes to mental health. The overuse of digital solutions has become in itself an impactful instrument. It could have a negative or a positive impact. And again, that's debatable because the overuse of devices is now registered. The gaming is registered as a mental health addiction. So again, very important to keep track of the different factors, the risk factors within this model that I share with you. And again, I'd love you to have the slides because it will enable you to also open up the WHO optimal mix of mental health services. And if you look at this slide, if you look at the pyramid, you look at level 1 and level 2. That's where a lot of the innovation could be unlocked when it comes to self-care and community care, specifically when it comes to mental health. When you look at the infrastructure in level 3 and above, that's when you see the gaps within the health system itself when it comes to the mental health ecosystem. On the right-hand side, or your right-hand side, my left-hand side, the comments that I've put out there integrates or realizes three things. Number one, mental health is all about care coordination, right? It's actually how the communication and the patient journey flows through counselors, physicians, psychiatrists, psychologists, and nursing and whatnot. So it's very important to understand that mental health is all about care coordination. That's number one. Number two, mental health is an essential element and tool at the primary care. So the more you can tackle mental health at the community and primary care and the tools that you can enable, the more cost effectiveness you can actually produce. When it comes to secondary or tertiary care, that becomes highly costly on the system. And number three, the empowerment of the patient role. And one of the most important aspects, using the devices. The simplicity of the tools could actually help you enhance prevention, promotion, and awareness when it comes to mental health. So again, what I did, I took this model and I broke it into a number explanation and examples to help you as you build your business model and you reinforce your startup solutions when it comes to mental health. And the areas that you can focus on if you want to develop or leave an impact on mental health population is basically when it comes to self-care and community care. Because mental health is not just the care coordination that comes around it, where you have the patient journey, but also the community and the patient family engagement models that you can build within your applications and your solutions. That's why it's very important as you look at level 1 and level 2, you keep those two ideas or keep these elements into your approach. And when you come to the primary care, the psychiatric services at the tertiary and secondary care, or even you go into the community mental health services, or you take, for example, elderly care or end-of-life care, you will be able to look at some of the gaps specifically as we implement more Web3 and metaverse technologies and whatnot. Okay, so this is maybe my last slide. What I wanted to share with you, where are the burning gaps in the mental health ecosystem? And believe it or not, everywhere you see a flame, it's a burning gap. And I'll leave you with this slide because the potential for innovation and disruption in mental health, specifically at this time, as we go through the war in Ukraine, as we come out of COVID, and there's a number of crises coming out when it comes to pandemics, it's very important that we start looking outside the government budgets or outside the government thinking to look at the newbies, specifically the millennials who are coming up with great ideas. And they are the most affected segments of population. Just as a closing remark, in a US report that came up in 2021, only anxiety and depression, 56% of the adolescent between the age of 15 to the age of 24 has been labeled as or diagnosed with anxiety and depression. And that is in 2021 in the US alone. Okay? If you compare the same percentage of the adult population, it goes around 19 to 22% of the population of adults in the US. And 50% of that is severe to moderate cases, again affecting your productivity. So if you are employing millennials, workforce wellness and enablement and mental health security is a very important aspect of the workforce. And I think with this, I just want to leave you with this slide as a roadmap if you are interested to actually explore ideas in fixing the mental health ecosystem. Again, as you look at it, the lack of workforce, the lack of education, the lack of research and finance. For example, in our region in the Middle East, there's not many publications. The most published country in the Middle East is Saudi Arabia, to a certain extent. It's nothing compared to what sort of open data sources that you have when it comes to the mental health research. And from a financing perspective, 9 out of every 10 employers in the US now, they are investing in the mental health and well-being of their workforce. Coming out of COVID, realizing the importance and the loss of productivity because of mental health. So, with this, I want to thank you. I'm on LinkedIn. I think earlier as well, so I can give you some more time back. But please let us connect. And if you have any question from a strategic or an ecosystem perspective, I would be more than happy to address. Thank you.
Thank you, Mazin. Thank you. I have, though, one question that I was asked to ask you. So one question only. You have met so many Estonians.
Oh, yeah.
What's your diagnosis on the mental health of Estonians?
Okay, that's a difficult question. Part of that answer will come in at 2 p.m. when I do my session at room number 4. Okay? As I'm instructed by Peter. But I think, look, the talent pool and the innovation that is coming out of the Estonian population is remarkable. I think there is a little bit more, perhaps, interpersonal skills that could be emphasized more.
Yeah.
More, I guess, the dancing that happened in the, in the break, that was amazing. I think you have the talent. You just need to leave it, get go, because these activities are very important for the happiness of any human being.
Yeah.
As a population of innovators in Estonia, I believe you have a lot to do and a lot to express as well when it comes to, guess, exploring and dancing and enjoying life. So I guess, yes, you guys are doing well. And I think there's a lot of innovation, a lot of great talent in here.
Yeah, thank you, Mazin, so much. So everybody have to dance now. You hear Mazin, yeah? Right? Okay. Thank you so much. Let's give it up for Mazin. Big applause. Thank you so much.